So, hi everyone. It's great to be here today. Thank you for joining us as we talk about systematic reviews and other types of evidence synthesis in tobacco regulatory science. My name is Jamie Hartmann-Boyce. I'm an assistant professor in health policy and management at the University of Massachusetts Amherst. And along with my colleague John, who will introduce himself in a moment, we're members of the Policy Analysis and Dissemination Core of Castor. Over to you, John.
Hello, hi everyone. I'm John Livingstone-Banks, and I'm a senior researcher at the University of Oxford, specialising in evidence-based healthcare.
So before we get started, a few housekeeping points. A reminder that you'll see this is being recorded for people to watch afterwards. We really want this to be interactive and encourage you to ask questions. If you don't feel comfortable doing so on screen, feel free to pop them in the chat, but also feel free to raise your hand at any point as John and I are presenting. We do have points to stop for questions, but we're also really happy to take them on individual slides. And if I don't respond to you straight away, it's because sometimes I can't see hands raised when I'm presenting, but someone will let me know and you will be able to ask your question. John and I have spent many, many years working together on systematic reviews within the tobacco control space. So we're really happy to be talking to you about them today. We're also really happy just to be a resource for you if you do go on and do systematic reviews or have questions about them, or if you think of questions that you don't want to ask during the session today but might want to ask later, please feel free to drop us an email. Both of us have pretty distinctive names, so if you Google our names, you will find our email addresses. As far as I know, there aren't any other Jamie Hartmann-Boyces or Jonathan Livingstone-Banks on the internet. All right. So what we hope to do today is cover four main learning objectives. The first is to explain the purpose and value of evidence synthesis. The second is to identify different types of evidence synthesis and their relevance to different questions in tobacco regulatory science. And then I'm going to hand over to John, who's going to talk us through how to identify a trustworthy systematic review or evidence synthesis product based on core review elements. That's useful as a reader of reviews. It's also useful if you're thinking about doing a review yourself about how to make sure that it is a trustworthy review that people can look at and understand what you're doing. And John will end talking through some of the ways in which you might think about planning next steps if you yourself are choosing to undertake your own evidence synthesis. So if anyone here has done or read a systematic review, you know that they can be long. They can be a little bit dry and formulaic, but we do them for a good point. At least we think so. So the aim of the systematic review is to present a reliable synthesis of all the relevant literature in an area. For it to be a systematic review, it should have clearly stated objectives, predefined eligibility or inclusion criteria. It should involve systematically searching the literature. So rather than just picking out individual studies that you want to include, you should be doing this in a systematic way. It should involve assessing the validity of the study findings, or in other words, their risk of bias, and it should be more than a sum of its results. So it should bring together study information in a meaningful way to look at patterns across the literature. We do this for many reasons. One of the main ones is that we know it is one of the main sources of evidence that a lot of people use to support decision-making. One of the reasons for that is that it saves time, right? So if you're a health professional, policymaker, researcher, or consumer, and you want to know what the body of literature is on a subject, you may well not have time to read every single paper that's been conducted on that and think about how much you trust it. A systematic review can help you there. Systematic reviews can also help prevent research waste. If we find a lot of studies in a review and they all have consistent answers and we trust them, then that might suggest that that is not a study that should be done once again, and instead that resources might be spent better elsewhere. Finally, one of, for us, the most rewarding things about doing systematic reviews is that they're a really great way to inform the direction of future research. The reviews that John and I do are typically updated pretty regularly. And what that means is that when we finish reviewing all the relevant literature in an area, at the end of the review, we'll say, this is the studies that we need to see next. This is how we can move towards more certainty. This is where research gaps are. These are the issues with the existing literature. And one of the most satisfying things about doing this work is that sometimes we'll come to update the review a few years later and find that someone has cited our review as rationale for doing a new study. We can plug that study into our review and move that evidence forward. So that's why we conduct systematic reviews. Why do people use them? As I mentioned before, it is an efficient way to access a body of research. It saves the user time that would be required for searching for studies. It can provide critical appraisal and interpretation of the results. We all know that if we just Google something to figure out the answer, the first article that comes up or the first blog that comes up or news piece that comes up might not be the most reliable one. So this is a way that hopefully you can find evidence that you trust a little bit more. Systematic reviews can also be a really useful way for you to explore differences between studies, whether those be differences based on what they're measuring, how they're measuring it, the group they're measuring it in. It's a good way to see whether or not something is a consistent phenomenon or varies across different parameters. And finally, a good systematic review should be, and certainly aims to be, a reliable basis for decision making because of the tenets that it relies on, including an unbiased selection of relevant information. And this makes them particularly useful, we know, and we see them used all the time for healthcare policy and shaping further research. So, in recent years, there's been a proliferation of systematic reviews, and within that, in types of systematic reviews. So there's a lot of language that is used to describe systematic review or review methodology. And I am sorry to say none of it is used particularly consistently. So what I'm going to do in the next few slides is introduce you to the different types of reviews using the definitions that John and I use in our work. These are definitions that are not unique to John and I. They're definitions that we see in the literature a lot. But for some of these, there really isn't total consensus on what it means. So be aware that if you see, for example, a scoping review in one place and a review that's conducted the same way but calls itself something else in a different place, that doesn't necessarily mean anyone has done anything wrong. This is an area where there are efforts to build consensus around terminology, but it is still somewhat lacking. So a review overall should summarize the existing literature in a particular area. And there are a few main types that we will now go through. The first of these, which many of you will be familiar with, is a literature or narrative review. These tend to provide a summary of a topic. They tend not to address a specific question. Unlike systematic reviews, these present results narratively without any sort of analysis or synthesis, and they don't always report on the methods used. The example we have here is a review of tobacco control policies in the 21st century, looking at achievements and open challenges. And often narrative or literature reviews look like an introduction to a topic. They're not trying to come up with any answers. They're trying to introduce you to the literature in an area. They are sometimes directly commissioned by journals who will want a review on a topic. And because they don't typically follow systematic methods, they can definitely be biased. And I'm not saying that as a casting shade way of biased, but if you are asking an author to review literature without using a systematic framework, they will probably pick and focus on literature that supports whatever position they might take in this space. So moving on from a literature or narrative review, a systematic review we paint as kind of the opposite side of that. So as opposed to a literature review, a systematic review should start with a very specific question, and it should list reproducible methods. This includes a search strategy, methods for searching different databases, inclusion criteria. It should assess the quality of studies, and it should synthesize the findings from studies or reports. Often when we see reviews written, they kind of just summarize each included study one by one without really making connections between them, finding patterns, or grouping them in any way. That's really a review that's not more than a sum of its parts. What we want in a good systematic review, and what they all aim to do, is bring together the information, weave it together in some way. Systematic reviews can be done across all different types of studies. So some of the more common ones are systematic reviews of randomized controlled trials, systematic reviews of qualitative studies, systematic reviews of observational studies. There are systematic reviews of modeling studies as well. And we'll touch more on some of these as we go through. Sometimes there's a misperception that systematic reviews have to look at the effectiveness of interventions. That's not true. That is one particular type of review, which is the one I'm coming on to now. So effectiveness or intervention reviews set out to look at the benefits and harms of interventions. These could be individual level interventions or policy level interventions. If it's an individual level intervention or indeed a policy intervention where a randomized controlled trial might be feasible, typically these reviews are restricted to that trial literature to avoid confounding. There are, of course, lots of questions where trials aren't feasible, and for that reason, it can also be totally appropriate to use observational data for effectiveness or intervention reviews. As I mentioned earlier, John and I work closely with Cochrane. We're members of the Cochrane Tobacco Addiction Group. Cochrane methods are generally considered the gold standard for this particular type of reviews, for reviews evaluating benefits and harms of interventions. This type of review often, but not always, and it's certainly not necessary, includes meta-analyses, or even go a step further to include something called a network meta-analysis. And I'll talk through that a little bit in my next 2 slides. These reviews of effectiveness also should include critical appraisal. So that means assessing studies using a risk of bias tool, which John will come into in the second half of this presentation. So just a quick aside as we talk about types of reviews, a meta-analysis in and of itself is not a systematic review, though many systematic reviews include meta-analyses. A meta-analysis simply describes the statistical analysis of a large collection of analysis results from individual studies for the purpose of integrating their findings. So there are groups, for example, that will meta-analyze just the studies they've conducted. That is fine, but that is not a systematic review. That is a meta-analysis where the information going into it has not been systematically identified. We use specific statistical techniques for meta-analyses because we can't just add the studies together and come up with a crude average. When we meta-analyze studies, the effect size of each study is weighted in relation to its sample size, if it's a dichotomous outcome in relation to the number of events, if it's a continuous outcome in relation to the measure of variance. And the results we get out of a meta-analysis should be interpreted as a pooled weighted average of the primary results for included studies. And the aim of the meta-analysis is to estimate the true overall effect size of, in the case of an intervention review, an intervention. They also should always be accompanied by some marker of uncertainty, for example, 95% confidence intervals. And what that means if we see a meta-analysis result with 95% confidence intervals is that we are confident the true effect lies somewhere within that range. In recent years, more complex meta-analysis techniques have been developed as well. And one of the most common ones is network meta-analysis, which again, we might see in effectiveness or intervention reviews, but don't always see. Again, network meta-analysis can be conducted in the absence of a systematic review, but it's unlikely. I would say this would be a very questionable approach to take if you weren't systematically reviewing the literature in the first place. So like a standard pairwise meta-analysis where we're comparing an intervention and control group, in a network meta-analysis, we're also using data from existing controlled studies. But the nice thing about network meta-analysis that brings it a step further from pairwise meta-analysis is that we can compare 3 or more different interventions simultaneously using statistical analysis. So this is really useful if we're interested in comparative effects of an intervention. Unlike a pairwise meta-analysis, network meta-analysis uses indirect data. When we are doing a pairwise meta-analysis, we're looking at direct comparisons. So that means trials that are comparing intervention A and intervention B in a head-to-head way. What I mean when I say network meta-analysis takes in indirect data as well is, let's say we have a intervention B that we're interested in, and we want to know how it compares to intervention C, but we don't have any randomized controlled trials that are directly comparing the two. In a standard pairwise meta-analysis, that would be the end of the story. We'd say we don't know how they compare. But what a network allows us to do is say, let's say there's a third intervention A, and we do have trials that directly compare A and B, and trials that directly compare B and C. What we can do with network meta-analysis is use that data to infer the relationship between B and C. As you might imagine, this traditionally and originally was used in the space of pharmacotherapies, where B and C might be 2 different active treatments and A might be placebo. But it's moved quite a lot beyond that now, and many different interventions have been assessed using network meta-analysis. This diagram, however, is a absolutely gross simplification of a network meta-analysis. They never look like this. They look maybe a little bit more like this or even more complicated. So diving back into different types of reviews now, some other ones that you might have come across include a living systematic review. What we mean here is that usually a systematic review is kind of a standalone product. You set out to do it, you conduct your searches, you do your screening, you write it up, and you publish it. In a living systematic review, the process doesn't stop there. And what this means is that every month, usually, searches are run for new evidence, and the review is updated whenever anything that's published might meaningfully change the conclusions. This tends to be a very resource-intensive process, and it's typically used for areas where there's an existing uncertainty in the evidence base. We know new studies are underway and are likely to provide more certainty in the future, and policy or clinical decisions need to be made quickly. So where we really saw an explosion in living systematic reviews was during COVID, when new studies were coming out every day and no one wanted to wait around to see what they found and wait for a full systematic review to be conducted. They wanted to just be able to plug in the new studies in these living systematic reviews. John and I are involved in 2 living systematic reviews, both relating to e-cigarettes. These are externally funded, and I would caution anyone from doing living systematic reviews without funding because they are extremely time intensive. But we have published 8 or 9 iterations of that to date, and we'll continue doing so. We're happy to take questions about that process. So going on to a few other types, there's qualitative evidence synthesis, which brings together data across qualitative studies. These tend to be really useful for looking at questions that involve experiences, beliefs, perceptions. Things around implementation of policies or programs can also be really useful as well. Anything where qualitative data is useful for understanding an answer is also very useful to synthesize. Qualitative evidence synthesis also uses predefined methodologies. So we don't end up doing meta-analysis because we don't have statistical data, but there are predefined methodological approaches, including thematic synthesis and meta-ethnography, that require following a set list of steps in order to synthesize the data that you find across qualitative studies. Now, the last few we wanted to talk about relate to scoping or mapping. So scoping reviews are really commonly used now, and their aim is to survey available research on a topic. Unlike an effectiveness review, they're not trying to come up with one true overall effect. They're not going to be conducting meta-analyses, but they are identifying the nature and extent of existing evidence, key concepts, and potential gaps in knowledge. And these are often used to help inform further research or further modeling in a space, or to understand what's really out there in a systematic way before moving on with another project. These are often, but not always, a preliminary step towards future evidence synthesis work. So you might start with a scoping review and say, oh, actually, we do have enough studies that we could do a systematic effectiveness review looking at this particular slice of information. Typically, scoping reviews don't include any formal synthesis. They definitely don't include meta-analysis. So if you see a scoping review with meta-analysis, at that point, most people would say they were mislabeling their review, and it is probably a systematic review with meta-analyses as opposed to a scoping review. And typically, scoping reviews also don't include formal critical appraisal, so they don't usually apply a risk of bias tool across all their studies, but they may well talk about limitations in the evidence and particular ways to overcome that in the future. Often sitting alongside scoping reviews and increasingly used as well are something called evidence and gap maps. These aren't reviews in and of themselves, but they do involve reviewing the literature and will often go alongside a scoping review or a systematic review. I'll show you an example of this on the next slide, but these are a visual representation of the available research evidence on a particular topic. They're originally envisaged as something that's particularly useful for policymaking communities because they provide an interactive framework where you can hover over elements of the map and it will show you which studies meet the criteria you're interested in. You can apply filters. So for example, say I only want to look at studies from a particular country and it will filter those out for you, or only want to look at adolescents, it will filter those for you. And the idea of these is to guide people towards relevant research. There's no synthesis here. You don't even extract results when it comes to an evidence and gap map. You're just saying, here are the studies that exist and this is what they look at. And you map always on the methods and not on the findings. So an example here, and I know it's not the greatest screenshot, is of an evidence and gap map from a review we did looking at electronic cigarettes and subsequent use of cigarettes in young people. This is published in the journal Addiction for anyone who's interested in looking at it, and the live version of it, it's up there too. But the idea here is that these are all these orange circles represent studies, and the bigger the size of the circle, the more studies there are in that area. The blue and yellow dots represent lower and higher quality systematic reviews, and these are all mapped on a framework. So down the side, we have different exposures, and along the top, we have different outcomes. If you were using the interactive version, you could also filter on certain things, like does this study provide results broken down by age, for example, or by e-cigarette device type. So this is something that we are seeing used more and more. For anyone who's interested in doing this themselves, the way that this is done is using typically a software called EpiMapper. John and I are also very happy to talk about that. So the last type of review I wanted to focus on was an overview of reviews, otherwise known as an umbrella review. Those terms are used pretty much interchangeably. And the idea here is that we have so many systematic reviews in certain areas that it can be the most efficient way to access the literature to actually look at all of the systematic reviews that have been conducted on a topic. So an overview of reviews or umbrella review will review and appraise existing systematic review literature. This can be an efficient way to cover a large and sometimes diverse body of research, but it is, of course, limited in that there is always a time lag between a study publishing, that study making it into a systematic review, that systematic review being published, and then you finding that systematic review in your overview of reviews. So if you're in a really fast-paced area and it's really important you to capture everything that's ever been published on it, this is probably not the technique you want to use. If, on the other hand, you want an overview of what's out there so far and to understand whether or not there's consensus in particular areas, this might be a very good path to go down. One of the nice things about this approach is it can also help identify reasons for differences between review conclusions. Or on the other hand, if there aren't differences, reassure of consensus in a given area. You know, sometimes topics we work in, we hear people say, well, no one knows, no one can agree. If we conduct an overview of reviews and all of the reviews are finding the same thing, that can make us a little bit more confident that there is actually consensus in a space. So those are just some of the types of systematic reviews. We chose to pull out the ones that we thought were the most relevant to tobacco regulatory science. But just to be aware, some other types of reviews that we see around a lot, there are prognostic reviews, which look at different prognostic models and how different factors might predict disease outcomes. There are diagnostic reviews, which tend to bring together studies of diagnostic test accuracy to look at which tests might be the best at detecting specific conditions. We've done quite a few rapid reviews in our time. These are ones that don't follow as rigorous of a framework. They typically don't involve meta-analysis. But during COVID, for example, we did these quite a lot when people just needed answers as quickly as possible. Integrative or mixed methods reviews pull together both qualitative and quantitative data in the same review using specific sets of methods for that as well. And methodological reviews will go through and they will look at all of the methods available in a specific area and try and build consensus or highlight differences between those. So that is it from me. Before I hand over to John, I wanted to take a minute to pause for questions. I will stop sharing so I can see your faces and see if you raise your hands, but really happy to take any questions on anything we've covered so far. Ken.
Yeah, thank you. That was terrific. I mean, a really beautiful assessment of the various methods and approaches. One thing I'm wondering about, have there ever been attempts to replicate a systematic review that has been done by, let's say, a group of 5 or 6 people, but then you have another group of people who are using sort of the same methods and looking at the same broad body of literature to compare and see whether they're getting consistent results, because that's kind of the gold standard of science.
Yes, great question. And there are cases of this. So within, for example, the area of e-cigarettes, this is done all the time. I don't know if it's done deliberately to replicate results or done because reviews of e-cigarettes tend to be published. But we absolutely see that happen, and we can look across those reviews and try and see, are they finding the same things or not? There are also other cases where people have gone out deliberately to replicate findings from another systematic review to check its validity. I can think of at least one case which is not in tobacco regulatory science at all and has to do with a cardiovascular disease outcome where a group questioned a existing systematic review, thought it was biased and flawed, and did indeed go through and redo it and find something quite different. So there is precedent there.
Thank you.
Any other questions at this point before we hand over to John?
Jamie, I have a question. So if I'm currently doing a scoping review that I'm just not sure about how much evidence there is out there about this topic. And so there may be enough that I could do a systematic review after this or not. But how do you kind of transition from one to the other? Do you have to go back and do the whole thing again from the beginning, or can you kind of use the base that you've got? And of course, you want to go back and look for new evidence that may have come in and incorporate that into your review if you're following, if you're doing it in a very systematic way for the scoping review process.
That's a great question. So no, you do not have to kind of like reinvent the wheel totally. The way that I would approach it is if I'd done my scoping review and thought, yep, okay, there is a particular area of this where I want to do a systematic review, I would be extremely transparent about that from the start. So I would register a protocol that says I'm conducting a new systematic review. It builds off work I've previously done in this space. So if you're confident that up to the search date you used for your scoping review, you would have found anything relevant for your systematic review, you can say, we're using studies identified through the previous scoping review and updating our searches to capture anything that's been published since that search date. Even if you've done some data extraction for your scoping review that you're going to build on, you can say you're going to use that as a foundation. Just be very clear and transparent that that's what you're doing, but doing that in and of itself is an efficient and pragmatic approach, and certainly not one that I would be inclined to criticize.
Okay, great. And we are pre-registering what we're doing for the scoping review and all of that. So, okay, thank you.
Thanks. Dorothy.
Yeah, thank you, Jamie. That was really, really great presentation. I'm wondering, the overview of reviews. So that could involve reviews that have different methodologies, right? So you can have one that does randomized clinical trial review and another that does observational review. Is that right?
You could do. So it would kind of be up to you in defining your inclusion criteria. But yes, that is absolutely possible.
Okay, great. Thank you.
It does get trickier then because you're often not comparing like with like, but it's absolutely a valid approach to take.
Thanks.
Any other questions before I hand over to John? Okay, John, over to you. And if more questions come up about types of reviews, happy to take those at the end as well.
Absolutely. Right, give me a moment while I set up slides. Okay, so if I've done that properly, there should be an adorable dog visible to all of you. And if not, then you probably think I've gone a bit strange. But either way. Right, so in this session, in this section, we're going to be talking about how we can recognize how well conducted a systematic review is. We're going to be focusing primarily on systematic reviews looking at interventions. Some of these principles apply more broadly, but for some of the designs that Jamie's mentioned, there will be slightly different standards that apply. So it's worth considering some of this relative to the guidance and standards of some of those specific designs as well. As Jamie mentioned, there's been a huge proliferation in systematic reviews. If you go on PubMed and search for pretty much any topic and filter down to systematic reviews, you'll find probably thousands of results. It's kind of crazy. And just like with any other kind of research, unfortunately, not all of them have been well conducted. And why that's especially problematic with systematic reviews is, as Jamie was saying at the beginning, they're a great guide for a lot of decision making. They give you a shortcut to a lot of answers, so they can be a very powerful tool. So if you are over trusting of a less than well conducted systematic review, then that could have a really negative effect in terms of biasing you in one direction or another away from the truth. So we're going to be talking now about the different aspects of a systematic review you can look at as a kind of spotter's guide for quality. We're going to break it down, look at what those signs of quality are, and we'll be focusing at that from the perspective of recognizing a good review, but it also could just as easily act as a checklist. If you're planning out your own review, you could think, well, I've got to address each of these points in turn and make sure that when John and Jamie find my review in the future, we get to tick those boxes and think and recognize what a great job you've done. And this is where, there we go. I always struggle moving on slides whenever I'm sharing for some reason. Okay, so I'm going to start off by thinking generally about the principles of good systematic reviewing. And this is the bedrock of quality for any systematic review. And whenever you face choices about systematic review methodology, if you come back to these principles, then that's going to serve you really well. So the first one is systematicity. Clues in the name, right? They're systematic reviews. But what I mean by that is, for a systematic review, it's crucial that, one, it approaches the finding of evidence in such a way that it's going to find all of the relevant evidence that meets the inclusion criteria. If you're not finding all of the eligible evidence, then you're going to risk running into biases that are going to corrupt your answers. But also, when we design our methods, and specifically when we apply our methods, we need to apply them exactly the same way across the board. So, for instance, if I have a study and I'm not sure whether it's eligible for this review because it's got a slightly odd design that I've not encountered before, when I make a decision whether or not to include it, I can make a justification for that, but it's only going to be systematic if I use that same reasoning every time I encounter a study of that design. So any judgment call that I have to make or any application of my methods, I have to do it the same every time. I also need to be transparent. So transparency is our second principle. And this is a quality of the reporting of our review. So a good review should report all of its methods, so what was done, but also it should report in enough detail that in principle, someone who came along and read that review should have enough information that in principle they could conduct that review for themselves. This goes doubly for instance, if when you're conducting your review, you need to deviate from the protocol for some reason, something has come up, there are unexpected results or studies of a design that you didn't anticipate, or there's something in your analysis that there's a good reason why you should do something differently than planned. The important thing is to be transparent in reporting that. So say exactly what you did, highlight that it's a deviation from protocol, and give the reasoning why. And this all just contributes back to someone reading your review should be able to see exactly what you did, see why you did it. And if they disagree with those methods, well, they can take your results with a pinch of salt. Or if they really disagree with those methods, well, they can go read a different review, can't they? These two principles combine to make our third principle, which is reproducibility. So we all know about the importance of reproducible science, and systematic reviews are no different. So in principle, if you have applied your methods systematically and you have reported them transparently, then your review should be reproducible. In theory, someone conducting the review should be able to use yours as a guide manual, follow your methods the way you did it, and they should find the same results. And we've got a little diagram on the slide here. I love this diagram. I stick it in pretty much every systematic review related session I do, because I think it perfectly encapsulates the process. Unfortunately, I have no idea where it came from, so I can't credit whoever created it, but I really owe them. But this represents, we can see at the top, the studies out there in the wild. They're all jumbled and, somewhere in PubMed squirreled away. We find them and we bring them in. We funnel them through the magical systematic review process funnel by applying our methods systematically and transparently. And then we come out the other end with our systematic review, which is ordered and organized and greater than the sum of its parts. So a good systematic review should have a range of elements that we can check off one by one in terms of judging the quality and how well it's been conducted. So first off, cannot stress this enough, it should have a clear and answerable research question that's been explicitly laid out. It should also have a protocol that's been registered in advance, made publicly available somewhere. There should be a systematic and transparently reported search strategy that's good enough to find all of the eligible evidence. There should be a process for screening and data extraction that allows us to find those eligible studies, get the data from them, and minimize the risk of human error. There should also be a quality assessment. It's no good for us to synthesize the evidence if we're not also going to give some indication of how confident we can be in those conclusions based on the quality of that evidence. There should be not only some kind of analysis or synthesis, but there should be a reasonable and concrete plan for how that's conducted that makes sense and is well suited to that first point, that clear and answerable research question. There should be interpretation, and that should be in line with the results of the synthesis and not making any undue leaps of reasoning based on good induction. And then finally, there should be conclusions and recommendations, and these should follow directly from the evidence and again, not make undue leaps of reasoning or incorporate things like, say, author biases. Now, those are our 8 key points. We're going to go through each of those in a little bit more detail. If at any point you want more detail on something as I'm breezing through them, then do feel free to shout out or stick something in the chat or raise your hand and we can go in on a little bit more detail. So first off, what I reckon is the most important part of planning out a systematic review or recognizing whether a review is any good is having a clear and answerable research question. Now, this sets out, for instance, if you're looking at an intervention, it should set out in detail what the intervention is, how it's delivered, who it's delivered by, what the setting is, etc. There should be a clearly identified patient population or relevant population. There should be a comparator with what the intervention is compared with, again in sufficient detail, and the outcomes should be well defined. Not only what those outcomes are, but how they'll be measured. And from having a well-defined research question, a lot of the methods of how you're going to conduct the review are going to fall out from there. Everything should be related back to that. For people who are thinking of designing a systematic review, this is the stage where you should put in more work than seems sensible. If any of you have ever done any sewing or woodwork, you might have heard the phrase measure twice, cut once. That really applies here. When we're appraising a review, it's no different. We want to see that they've set out a clear and answerable research question, and so that we can judge those methods and how they relate back to specifically answering that question. It's no good if they're just fishing around for answers, because that way bias leads. Where we can look for this, Typically, great places to look are going to be hopefully right up there in the title and abstract, but you may also find it in the objectives or the end of the introduction. There might be a summary of exactly what it is that they're interested in. But if you can't piece that together very easily and very explicitly, then that might be a cause for concern. Second up, we want there to be a protocol. Protocols are extremely important, especially for systematic reviews. Why? Well, they provide a framework for the methods of how that review is going to be conducted. So they're really handy for the review authors because they set out all the steps they're going to take. They reduce the potential for bias in that process. And they're a way of authors holding themselves scientifically to account in public. They also serve practical purposes in terms of reducing or hopefully avoiding duplication of efforts. They're almost a kind of way to Bagsy a topic publicly. You can declare that you're conducting a review on this topic, so someone who's interested in conducting a review in that topic can see that you've already posted your protocol, and if they want to do it, well, they could either work with you or maybe they could move on to another topic where more work is needed. Crucially for you when you're appraising a review, you can assess some of the biases in their methods and how transparent a review has been, because you can compare the methods they used back with the ones that they registered in their protocol. If they haven't published a protocol or made it available somewhere online, that could be a cause for concern, because you can't hold them to account in any way. So you don't know if any biases have crept in that process, or if they've amended their methods in a way that is less than legitimate. Where are you going to look for this when you're appraising a review? Usually you'll be able to find it somewhere in the beginning of the methods section. There should be a pretty concrete statement that there is a protocol or that it was pre-registered, somewhere like Open Science Framework, or there's a place called Prospero specifically for systematic review protocols. Next up, we've got a few steps here combined. So we've got the searches, the screening, and the data extraction. So these are the steps whereby you're finding the evidence that's going to go into the review, and you're extracting the data that you will then be synthesizing for your final review. Now, if you're appraising a review, trying to figure out if it's going to be a reliable source of evidence or not, these are going to be some of the steps that are indicative of how reliably they've gone through the steps of the review process. If they get these steps wrong, there's a real risk that either human error or human biases have crept into the process. And that could be really problematic in terms of how it might bias the final results. So we want to know that they've conducted good systematic searches that are likely to find all of the eligible studies. This will take the form of searching various online databases. There's no hard and fast rule for instance, how many we might want them to search, but you'd certainly want them to have searched a couple of different databases. And if there are databases that a lot of, for instance, tobacco science appears in, then you'd want to see that they've searched those. For instance, Medline and Embase are great general medical databases, but also a lot of tobacco science comes up in PsycInfo, which is a slightly more niche database, which people don't always search. We'll also want to know if the authors have made any attempts to identify unpublished studies, what we sometimes hear called grey literature. So, as we know, not all research that gets conducted is published in academic journals, sometimes for perfectly innocent reasons, sometimes for slightly misleading reasons. But we'll want to see that some kinds of steps have been taken and have been laid out in the methods of that review for how the review authors are going to try and find that. Otherwise, there's the potential that we may encounter publication bias, whereby which studies have not been published and therefore made it into the review could end up skewing the final results. We also want to know how up-to-date those searches are. It's all very well, if I'm reading a review that was published this year, well, that sounds great. But if the searches were conducted 4 years ago, that could rapidly be out of date. I mean, imagine, say, a systematic review on e-cigarettes for smoking cessation where the searches were dated 4 years ago. They'd be missing loads of relevant evidence. So checking how up-to-date those searches are is going to be key. Likewise, it's all very well and good for them to have conducted those searches to a high standard. We then need to know that they've screened well as well. So screening is the process by which review authors search through or check through all of the results of those searches for which studies are actually eligible to be included in the review. And the gold standard for this is to have 2 separate people independently read through or to check through all of these studies and then to compare their results and resolve any discrepancies. This minimizes human error. And in terms of the pragmatics of that process, we'd usually expect that to be broken into 2 stages. First of all, going through everything, looking at the titles and abstracts, and then a second round of screening where people are looking at the full text. And again, it's that doing things in duplicate that's going to help minimize human error. There are slightly less labor intensive, but still respectable ways of doing this. So say, for instance, sometimes if a review team doesn't have a lot of time or resource, what they might settle for as a pragmatic halfway is for one person to screen everything and then for a second person to screen, say, 10 or 20%, to see how reliable that first screener is. And that, again, is a way of minimizing human error a little bit, not quite as much as doing everything in duplicate, but ultimately sometimes we have to make pragmatic choices. So you can judge how much risk you think there may or may not be of eligible studies accidentally being missed. And the greater the risk there is, the more you might want to be cautious about interpreting the results of that review. Likewise, with data extraction, we want to see that there are steps that have been taken to minimize human error. And again, this is going to be down to things being done in duplicate. The gold standard is to have 2 people independently extracting that data and comparing it. But again, in a pinch, you could have someone doing all of it and then someone doing a sample to check how reliably that first person has done it. But ideally, you really want that to be done in duplicate, because think how potentially problematic a systematic error in data extraction could be in terms of distorting the results, especially of something like a meta-analysis. The place where you're going to look for this in your review is primarily in the methods section, but you may also see some of this in the results as well. So checking those areas is going to help you to identify this. Okay, next up, we want to see that there's been a good quality assessment of the included studies. So quality assessment, otherwise sometimes called a risk of bias assessment, is where we're evaluating the methods to which those studies have been conducted to see how likely the individual studies are to potentially give biased results one way or another. In a review, we want to see, first of all, that they have done such an assessment. If they've not, you need to be really concerned. And if they have, we want to know that they've done so well, that they've used good methods to do so. So a good starting point is to see if they've used a well-known, reputable tool for this. So we've got some examples up on the slides here. So if it were a study of randomized control trials, something like the Cochrane risk of bias assessment tool is going to be really reliable. For diagnostic studies, you might want QuadAS2. For observational, perhaps something like the Newcastle-Ottawa scale. And Acrobat NRSI is also a good one for non-randomized studies. You get sort of like a spread for different study designs. If they've used a tool that you've not heard of before, you may just want to check a little bit online and see if that's a well-known or reliable tool. But really, the vast majority of studies, or sort of reviews, should be using quite a small set of tools. I mean, there's no need to reinvent the wheel. Finally, we also want to know that not only have they used a good tool, but that they've applied it well. So again, we want to see in the methods that they've taken measures to minimize human error, especially with something like quality assessments, which can sometimes rely on a certain amount of subjective judgment. You guessed it, again, this is going to involve doing things in duplicate, hopefully 2 people independently reviewing for quality assessment and then comparing their answers and resolving any discrepancies. Where we're going to look for this primarily is going to be in the methods. Hopefully they'll set out how they've approached this in sufficient detail, because it's a transparent review, that you can judge that. But also a key step here is you'll want to have a look in possibly the results and certainly the discussion to see that not only have they done this assessment, but also that it has played a part in how they've interpreted the results. Because if they've appraised all these studies and they're all really terrible quality and they're all at really high risk of bias, if they then go and make really strong conclusions about how effective and safe an intervention is, despite the fact it's been based on all this poor quality research, well, that should be ringing alarm bells. We want to know that they've taken all of this into account in how they frame and interpret their conclusions. Speaking of which, the next step is going to be evaluating their analysis and interpretation. So this can involve a meta-analysis, but it doesn't have to. And in some cases, it really shouldn't. The kind of things you want to be looking for here are, first of all, whatever their synthesis plan is, whatever their analysis plan is, that it is well justified and well laid out with transparent methods. So again, you should be able to recreate this yourself if you feel so inclined. It should be well linked to the objectives that they set out from their well-defined research question. And it should take into account potential heterogeneity. Heterogeneity just being differences between studies. This could be differences in the population or the intervention. It could be statistical differences in the results. There's a range of different forms of heterogeneity. But we want to make sure that, especially in a meta-analysis, if they are combining different studies together to get that weighted average, that they're actually doing so with studies that are sufficiently similar for that to be a meaningful process. In terms of how those results are then interpreted, we want to think about, for instance, not only things like statistical significance, though of course that is still important. We also want to think crucially about things like clinical significance, whether or not those results actually result in a meaningful difference for the populations at hand. And also, again, taking into account factors that are going to affect how confident we can be in those results. So there's a very useful tool that we use called GRADE, which allows us to evaluate the reliability of a body of evidence contributing to a specific outcome. So this is different from the quality assessment that we have for individual studies. This is looking at all of the evidence contributing to an outcome for an analysis or a synthesis. And this allows us to judge how confident we can be in those results. Again, a systematic review or the conclusions of one are only valuable insofar as that review can tell you how much faith you should put in that review. Anyone can synthesize a bunch of studies of miscellaneous quality and then give you a result. Part of the real skill and the real challenge of a good systematic review is being able to then say how much you should trust that result. And so we'd want to see that they've set out methods for doing that and that they've followed through and taken those things into account in a reasonable manner. So finally, we want systematic reviews to give us reasonable and rational conclusions and recommendations. So these aren't necessarily going to be prescriptive. Indeed, say if you're reading a Cochrane review, then the rules that Cochrane set out for their reviews prohibit these kind of prescriptive conclusions. And you just say what the evidence says, and leave the reader to then make conclusions based on that. The idea being that those conclusions and recommendations aren't going beyond what you can genuinely infer from the evidence. They avoid making assumptions or incorporating the personal biases of review authors, and they take into account factors about the quality and the extent of the evidence, things like the risk of bias, the volume of the evidence, but hopefully still go beyond that basic, sort of recommendation that we've all read 100 times of, more research is needed. Certainly part of the job of a systematic review is to make recommendations for the research. And let's face it, there are so many topics where more research is needed. But a good systematic review should be able to dig deeper and tell you what kinds of evidence are needed. Is it that the studies are being conducted to poor quality? Is it that the study designs are not well suited, or that there are certain outcomes that have been neglected? We want to see in a good review a nuanced discussion that draws on what research has been found and where those gaps are. Okay, so if you're interested in planning your own review, then there are a few steps that you can take to get yourself started and off the ground. First thing is building a team. Systematic reviewing is not a solo activity. It's always a team sport. There are a range of different specialities that you would want to bring in. For one thing, you need some subject expertise. You probably want someone who knows a bit about systematic review methods, especially if you're not super familiar with them yourself. It's always good to have a seasoned hand on board. There's an awful lot to learn about conducting systematic reviews. If you're planning a statistical synthesis, then you may want a statistician, especially if it's going to be a complicated one, especially if you're using some of the more advanced methods like network meta-analysis or something like that. You may also want to involve a search specialist as well. So once you've got your team together, and that's often quite a fluid thing, you may end up recruiting more people as you go on. It's not uncommon for review teams to slowly bloat as the process progresses. You want to get some idea of what is out there. So this often involves what we might call a scoping search. So where you start to look for what evidence there is on this topic, get a feel for what questions have been answered by studies, what questions haven't. There's nothing more frustrating than planning out a systematic review only to then find that there just aren't really any studies answering the question you've set out. So a bit of an investigation process prior is really useful for refining that research question. But because before you start anything, you're going to put loads of work into defining that research question. And then lastly, this might be a bit of a no-brainer, but find some training that you can take. There are a host of resources out there and different training courses. And a lot of, or not a lot, but there are sometimes people who undertake systematic reviews thinking that they're not that hard. You just kind of, follow the steps. There's a handbook, easy peasy. And that can often lead to quite a difficult time. So finding specific training, especially if you're doing a more niche form of review, can be really valuable. And of course, there are people like Jamie and I who are always happy to chat about systematic review methods and advise people. That's how we have fun, because we're cool. Some useful resources. So the Cochrane Library is a great place to find examples of well-conducted reviews. By all means, not all Cochrane reviews are amazing and stellar, but the standards to which they are held are probably the highest, so I think a lot of them are very good, especially the ones that Jamie and I have written. There's also the Centre for Reviews and Dissemination, based at York University in the UK. There are also the PRISMA guidelines. So these are reporting guidelines, which give you a really detailed, broken down checklist of all the points that you want to be hitting, both for your published protocol, because you're going to publish a protocol, and for your published review as well. Finally, there's also the Systematic Reviewer's Bible, the Cochrane Handbook of Systematic Reviews, which gives you a huge amount of detail on the methods and standards to which you can conduct your systematic reviews. Some places that you can find further guidance include resources hosted by your institution. So these can often be found by the resources hosted by your library. They're a great resource. There will also sometimes be research librarians and information specialists at your institution who will be able to help you with searches. There is training available through various organizations and software platforms. So Covidence is a platform that you can use for systematic review screening, but they also provide a range of really helpful training resources as well. And there's also a lot of different training resources available online through different organizations. So Cochrane and Joanna Briggs both have online learning resources that you can use. Your institution may well have some. There's also MOOC platforms that make a lot of online learning available for free. Molly was telling us the other day about a particularly good one that was run, or at least included, some librarians from University of Michigan as well. So it may well be that some of your colleagues and collaborators have been involved in generating some of this training. And lastly, there's always Jamie and I. We're always happy to chat about this stuff. And as Jamie said earlier, we are very, very findable with our very long names. On that note, I'm going to stop sharing. And again, if anyone has any questions or things that you want to take off on a sort of tangent for discussion, then that would be really cool. Oh, Ritesh.
Yeah, thank you for that wonderful overview, Jonathan. I was curious about the gray literature you mentioned. Are there any recommended ways to identify research in the gray literature that's relevant to the topic?
So there's no one size fits all approach, but the way that I would approach it is thinking from first principles about what it is you're expecting there might be and how you might find it. So for instance, if what you're interested in is randomized control trials, you're doing a pretty straightforward review, trials testing an intervention versus a control, then really probably your best place is just to look on trial registries. So, clinicaltrials.gov in the US, or the ICTRP, which is the WHO's platform for pretty much all of the main trial registries. You can be searched through that. Because that's going to be a resource where you can find not only what trials are being conducted, because they should all be registered, but there's also often results published there as well. So it can both highlight the gaps, tell you where to look deeper, but also sometimes it will just give you the findings as well. If you're interested in something a bit trickier, say for instance you're interested in the effects of tobacco control legislation, then something you might want to sort of consider including is, say, for instance, research or reports that have been conducted by government bodies or institutions. So say, for instance, you want to know how effective plain packaging for tobacco is. What you might think is, oh, well, okay, I know there are a couple of countries that have already done this. Surely their governments hopefully have measured what the impact of that is. That's the kind of data which may not make it into an academic journal, but may well be accessible. So in that case, you could have a reasoned approach whereby, say, for instance, you could do a lot worse than getting in contact if you have contacts in those government bodies, but also using Google, you can search within certain government domains. Just by searching within websites. So you could search, say, within Australian and UK, .gov websites for some of those key terms, and you may well find government reports that are publicly available. So that's not sort of, going to be the same for every different question that you approach. I think it's really about sitting down and having a think about, what might I be interested in finding, and how could I go about finding it? There are things like grey literature databases, but honestly, I don't really know what they're for, because, grey literature is pretty much anything not published in an academic journal. So, I kept a blog when I was an undergrad. Would that be in there? I like, it just doesn't seem like a well-defined concept to me. Maybe that's really unfair of me, but yeah, I mean, sort of with my information specialist or search specialist hat on, that would be the approach I would take, is really tailoring to the situation of the review.
Thank you.
So that was a really long-winded answer as well. Molly?
Yeah, thank you both. And John, I'm sure your, undergrad blog is at the top of all the great literature databases. I wanted to just double check. I understand that the two of you are developing a couple of pre-recorded lectures for Castle, and I wanted to highlight that for this group, if that is happening.
Yeah, they've been recorded, and I don't know if they're live or sort of hosted yet. Or
I think they're live yet, but they've been recorded and approved, and John and I have signed our forms, so we hope they will be soon. I think they'll tell us when they are. So when they are, certainly we can share that information, Molly, and if people are interested, they'll be up on the Castle Tobacco Regulatory Science Knowledge Center.
And what were the topics again? I think one was on meta-analysis.
Yeah. So one was on developing a protocol for a systematic review in tobacco regulatory science. So similar but non-interactive of what we delivered back in October at the TRS meeting. And then the other one is kind of around considerations in meta-analysis in this space.
Great. Thank you.
Ken, you have a question?
Yeah, just curiosity. Most of the systematic reviews that I have read are restricted to English language. I'm wondering if anybody has tried to assess whether that has ever introduced bias and whether we're really missing something by restricting it to English language. I understand the reason for it. I'm just curious.
I am not sure. I'm not specifically aware of anyone sort of who's assessed it. I wouldn't be surprised if someone had, though. But yeah, I mean, as I'm sure you're aware, it is kind of a limitation that just comes purely pragmatically. And there are kind of two ways that some people approach this. So some people just sort of limit this through their searches, and some limit with their inclusion criteria. Even studies that are reported in non-English languages often will have a title and abstract available in English. So in principle, you should be able to identify which studies would potentially be eligible. But yeah, it is always a pragmatic choice. Yeah, sadly, there's kind of limitations always with these things.
Well, I would say I think there's less and less reason for excluding non-English studies now, just because the technology is getting so much better.
Yeah.
And there are also some like crowdsourced platforms where you can get people to help you translate certain bits if needs be. Where it's a problem is if you anticipate you're going to be including studies that were published in like the 60s, 70s, 80s, because those are usually not in machine readable form, and that you're really up against it. But if you have something that's recent and machine readable, Google doesn't do a terrible job for at least you determining whether or not it meets your eligibility criteria.
And certainly within tobacco topic reviews, I mean, we never exclude based on language, but I would say the number of non-English language studies that get included in our reviews, just in terms of how many there are, does usually seem to be quite small. So I would suspect the reviews that I've been involved in, at least, I think if you did arbitrarily exclude retrospectively all the non-English language studies, it probably wouldn't have had a material effect. But that is just my hunch. That's not based on any actual investigation.
Okay, thank you.
Ooh, just to say, it is up online, our tobacco regulatory science thing. I just thought I'd quickly check. I thought they'd let us know, maybe it's just gone up, but it is there under the courses and materials bit of the Tobacco Regulatory Science Knowledge Center, and it's the first 2 up there currently.
Cool.
I'll include a link in the chat. You do need a login, though, for it.
I have a question.
Yeah.
I'm just wondering if you have a sense of how artificial intelligence is going to be utilized to help with all these systematic reviews and meta-analysis.
I mean, it is on its way. There's definitely groups of people who are very busily developing AI and machine learning tools for assisting with certain parts of the systematic review process. So some of these are already being implemented a little bit. So Cochrane has a tool that uses AI to distinguish RCTs from non-RCTs in screening. And I think we can probably expect to see all of that continue to grow. So I think tasks like screening, identifying studies, so, the searching and screening process and also data extraction are probably all quite susceptible or, sort of quite workable problems. At the moment, there's no sort of foolproof sort of like AI can't do it for me type thing. But these tools are moving so fast. I think any sort of prediction I made today would probably be false next week. And I think it's probably only a matter of time before certainly those legwork stages can be fully automated with a certain degree of confidence. I think it's probably a matter of opinion in terms of how far we are from that. And my opinion wouldn't be especially well informed, so I wouldn't want to hazard a guess. But there's kind of a lot of waffling without really answering your question. I think, but it's certainly something that a lot of people are currently working on developing. So I wouldn't be surprised if over the next couple of years we see a lot more about it. I know Cochrane, I think, has just launched a new methods group on AI and evidence synthesis. I think I saw something about that this morning. So yeah, it's definitely going to be a space with a lot of movement, I think.
Thank you.
And Molly?
Yeah, I'll just chime in a little bit on that from having being in the process of exploring AI tools for systematic review. I think they have a lot. I mean, like you said, it's changing rapidly, as is everything in the AI space. And we're exploring one particular tool that has a free version and then a paid version. If you're going to use it for anything substantive, you'd really need the paid version. But what we're sort of looking at is using it in our data extraction piece more than the screening piece itself. Well, actually, and also screening for really simple things like age ranges included, where we're not looking for it to dive deep into nuanced content, but more like in the full text review, which is where we're probably going to have to do most of the age group screening. Does this include 12 to 24-year-olds in any capacity? But then also not trusting that it's going to do a perfect job and doing checks on that. So just like you would with a human screener, I think to be really fastidious in making sure you're double checking. So.
Yeah, and I think seeing an AI sort of tool reducing the need for things to be done in duplicate by humans is probably something that we'll see pretty soon, maybe. I can certainly imagine that. Bethany?
Yeah, I have a question about kind of balancing rigor of quality assessments with practicality. So I was a part of a review that was trying to look at smoking cessation interventions for Hispanics. And the review quality check that we were using, they were trying to get at selection bias, but part of the issue with that population, it is really, really hard to recruit people in general. And that's part of the reason why there aren't that many cessation studies out there. So, they were saying like, oh, if you recruit people from like a source, like a clinic, then it might not be high quality, or if you're recruiting people, if you could have a low percentage of people who agreed to participate, then that might indicate low quality. But kind of how do you balance like what you know about working with that population with like wanting to be really rigorous with the quality assessment?
Yes, that's a good question. I mean, first off, I'm not sure that either of those things would be reasons not to see it as good quality, I think. So I'd sort of advise a certain amount of caution there. But I mean, something that we've encountered in the past is sometimes you'll have a situation where the mechanics of the situation just preclude, gold standard ideal method. So a classic example that we encounter often is with behavioral interventions for smoking cessation. You can't effectively mask allocation, right? Because people are going to know whether they're receiving counseling or not. People are smart like that. So we tend to then think, well, that's not particularly helpful then to rank every single study as high risk of bias, because that's what you'd have to do for every single one of them. Even though technically there is that risk coming in, right? There is a risk of performance bias because, and that should still be acknowledged, but perhaps with your concrete tool, that's not going to be super helpful because then you lose the ability to distinguish between studies, some of which may be really well conducted, that aspect aside, and some may have further causes for concern. So I think there is ground to stand on in terms of, amending tools and using them in specific ways if that is well suited to the specific situation of that question. I'd certainly do so with a lot of experience in systematic reviews and can discuss from their experience and context. What I wouldn't do though then is neglect to also discuss those factors and how they may be having an impact overall. Because what you don't want to do is just dismiss the risk of that form of bias because everyone's going to be susceptible to it. Because if all the studies are susceptible to it, that is a cause for concern, right?
Yeah, that's what we were finding is that, almost every study was like moderate risk of bias because of some of these issues. I was just a part of the team. I wasn't a decision maker really for this, but I just was curious how other people approach that. So thank you.
Yeah, Bethany, just to chip in, I agree with John, and I don't know what tool y'all are using, but I would say that is not a risk of bias issue, and that is not selection bias in the way that selection bias is typically thought of, right? So I think one of the important things that we think about when we're critically appraising literature and studies is internal validity versus external validity. And when we're assessing risk of bias for individual studies, we're thinking about the internal validity of that study. And at that point, where they recruited from does not affect the internal validity of that study. It might affect its external validity or generalizability to other populations. So just bear that in mind, that when we would think about selection bias, we would think about, were people more likely to be assigned to one group or another because of some characteristic that they had, right? We think about, for example, randomization breaking there, if we're looking at randomized controlled trials. But certainly if they were all recruited from the same clinics, that wouldn't be something that we would consider as reducing the internal validity or increasing the risk of bias of that study. And as John said, you kind of don't want, you don't want to set up a review to fail in some ways. So, which I think is what John's touching on, right? Like, we don't want to end up in a situation where we're never able to say that there's good evidence that counseling for smoking cessation works, because those studies are going to never be able to overcome that issue with blinding. And there, what we want to do is pre-specify that we're changing the tool in this way, and this is why. And what we might do there is say, we prefer studies with matched amounts of contact time, for example, as a way to try and mitigate some of that performance bias.
Yeah, thank you. That's great advice.
Okay. Well, John and I are available over email too if any other questions come up. We're always happy to chat about this stuff, as John mentioned. We like it. So I think that's it. Thank you so much, everyone, for attending. We really appreciate it.